Free veterinary care for military and law enforcement canines across the country. Check out that one there. Let's bring in Paws of Honor President and founder Bob Youngblood, Dr. Matt Brunke, and Medical Director for Veterinary Surgical Centers Rehabilitation Canine, Christy, and her handler, Catherine Burton. Wonderful to have you all here. Bob, thank you for all that you do. How do you find the dogs and get them to the care that they need?
That's the easy part. We run a veterinary clinic right outside D.C., and we've been taking care of federal agents, local canines for 30, 40 years. So we've been taking care of these dogs as they're working. So we had the relationship with them, and once they age out or decommission or retired, that's when Paws of Honor started to take care of some of the expenses related with retirement of the canines. So it's easy here, but we realized very quickly that there was a need across the country for this care for these canines once they retire. So we've expanded. We're in 30 states at this point. We have 25 veterinary affiliate clinics throughout the country, and we've done all this since 2015.
I just want to put up on the screen for everybody, you have helped more than 370 retired dogs, spent $1.8 million in veterinary care, partnered with 25 veterinary hospitals that you were just mentioning, and represented it in 30 states. Dr. Brunke, Bob was saying that finding the dogs is the easy part. What's the hard part?
The hard part is making sure that they have a good quality of life in their retirement. Right? These dogs don't get a pension or health insurance coverage once they're retired. So Paws of Honor brings awareness to that and provides the funds to make their care and their retirement quality. Once we can do that, then we can add in things. So why have them take pills all the time if they're painful? We get to inject things like nuclear medicine now with 1-year benefits or more for arthritis with these dogs. Using stuff like Synovitin, or even dealing with dogs that have lumbosacral disease, like sciatica, like people, and we can inject things into those dogs' backs to help them that they're comfortable and enjoying their lives.
They gave us so much, and Catherine, we're seeing pictures now of the dogs that you have there. Maybe you can tell us a little bit about yours, and are they able to relax? I mean, they obviously have been trained to work, defend us, do all of these hard things, but in their retirement, do you see that they can have some fun?
Oh, absolutely. So this is Canine Christy, and she worked for 5 years as an explosive detection canine for a DOD facility. And our dogs, they know the difference between work time and play time. So even throughout their career, we have downtime for them. They get to play out in the yard with the other dogs. But as soon as they get the command to work, they know it's go time.
I love that. Bob, quickly, if you could just tell us if people viewing want to donate, where they could do that, and also, are the dogs available for adoption?
No, we do no adoption. You have to understand, Dana, these canines are different than normal dogs. These are the handler's partners. It's their teammate. They use these dogs to save their lives. They're in bad places in the Middle East. They use them as pillows sometimes to sleep on. It's a bond that's totally different than that. So no, they're never adopted. Okay. The handlers always take them, and that's where Paws of Honor comes in place.
That's really good to know. That's good to know that they get to
burden away from the handler.
Yeah, it's great to know that they stay together.
People go to pawsofhonor.org. You can donate there and spread the word. I don't think a lot of people understand or recognize that once these canines are decommissioned, retired, all their benefits stop. And I think if everybody realized that, they would be more willing to.
So we have to pick up where that leaves off, and we will. Thank you so much, everybody there at Paws of Honor. We appreciate it so much. Sandra, yeah.